Hi, and welcome to another video from Dr. Ties. We all get dry skin at times, and this can be due to various reasons such as cold and windy weather, new skin product or washing powder. In this video, I will explain why dry skin occurs and how it can be treated effectively. I will also talk about various measures that can be taken to prevent dry skin from getting worse or coming back. Please don't forget to share and like our videos. Dry skin occurs when the skin loses water more quickly than usual, leading to dehydrated skin. The most common causes of dry skin are increasing age, seasonal variations, certain medical conditions like eczema and contact dermatitis, and various skin products. Dry skin can also be caused by central heating or other heaters, having frequent baths or showers, using soaps on the skin, washing products, hard water, or cold and windy weather. Dry skin can feel rough or tight and can lead to discomfort, itching, cracking, or flaking. If someone has eczema and dry skin, this can be aggravated by pollen, pet fur, house dust mites, detergents, biological washing powders, or allergies to certain foods. Dry skin usually gets better quite quickly, but it can last longer in people with eczema or contact dermatitis. Dry skin can be treated with various emollients. Emollient is a medical term for moisturizer. Emollients come in the form of creams, ointments, and lotions. An emollient can be used to moisturize the skin, reduce itching and inflammation, and help skin to work better as a barrier to irritants and infections. Ointments are usually more effective at moisturizing dry skin. Creams and lotions are cooling and work better for inflamed skin. As ointments can be greasier than creams, some people may prefer to use them at night, and to use creams and lotions during the day. The general advice is to use an emollient as often as needed, and this can be every 2 to 3 hours if the skin is very dry, to use plenty of emollient each time, to use a clean spoon to remove the emollient if it is in a pot without pump dispenser to prevent bacteria from fingers entering the emollient, to use the emollient just after washing once the skin has been pat dried and still moist, to apply the emollient in the direction of the hairs on the skin to avoid blocking the hair follicles, and to not share the emollient with other people. If one emollient does not work or cause skin irritation or stinging, a different emollient can be tried until the best one is found. If the skin is inflamed, a topical steroid like hydrocortisone cream or ointment can be considered. Steroid cream or ointment should be put on the skin about 15 to 30 minutes after using the emollient. It should be used for 48 hours after the inflammation is better. Steroid creams should not be used for more than 7 days at a time, as prolonged use can thin the skin. To prevent dry skin from getting worse or coming back, it is important to use plenty of emollient each time and keep using it after the skin has improved, to drink plenty of water to prevent dehydration, and to shower after swimming to wash away the chlorine. It is advisable to avoid using soap or bubble baths, to avoid frequent baths or showers, and to use warm instead of hot water, to avoid wearing woolen or rough clothes, and to avoid spending a lot of time in air-conditioned places. It is recommended to see a doctor for further assessment if the dry skin does not get any better after 14 days of using an emollient, or if there is a high temperature, crusts on the skin or pus leaking out, or very inflamed or swollen skin. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.